Hi everyone and welcome to Horizon Scan. Today we're talking to Tony Yardley-Jones about coronavirus and its implications for business decision makers. Tony is a specialist in occupational medicine with particular interest in executive medicine. With us also today is Peter Osborn, who is the founder and chairman of Flexiion MSP. So Tony, perhaps you could help us cut through some of the politics surrounding this and actually get down to some of the facts, the things we actually know about coronavirus.
We haven't seen anything like this virus before, I think it's fair to say. The way it presents and the way it actually infects people and causes problems with people is something we have not seen before. We know that the virus replicates in the upper respiratory tract system like many of the coronavirus does. But actually this virus is very different because from there on, it then has quite a profound effect in people who are severely affected in virtually every organ in the body. The early days, we didn't quite understand actually what to do with this. And you will remember that there was a lot of focus on actually putting people on ventilators very early. And we soon learned that actually that probably wasn't a good idea in some cases. And as you'll have read, conditions, systems like CPAP were brought in to prevent people from going on ventilators. Because once you go on a ventilator, things actually can be very difficult to manage. The other thing we realized is that this was unlike any of the other coronaviruses. There's around 7 of them, I think 4, 5, 6. The C19 is the 7th. And this one actually has a profound effect in some people on the vascular system and coagulation. So there what's happening, it presents in people with very different ways. So initially it was regarded as a respiratory virus, which was the chronic cough and the temperature. But we then found out that actually there were many other types of presentation. And soon in my clinical experience talking to people is that people would present with confusion, with memory issues, they would present with renal problems, they would present with clotting. And so therefore it soon became that this was actually something that we had not seen before. And 2 descriptions which helped me understand how to describe this to people was I called it the chameleon virus, because it presents very differently in some people depending on age, depending on sex, and also ethnicity. The other thing is treating the condition was a little bit like sailing a ship whilst you're trying to build it. But we have come a long way since then, and certainly the Italian experience taught us quite a lot of actually how to help manage this condition. And we have a long way to go. There are some progress, which you'll have read in the press about some of the medications. The game changer will be a vaccine, and there are many vaccines in development at the moment, but I think that is going to be some time before we get something that is practicable and effective, and we may have a range of different vaccines depending on who you give it to and what you're trying to achieve. So for example, you may have a different vaccine for younger people than you will have for the elderly. So where we are at the moment is the virus is still around. It has slowed in the UK, but it's still out there. And the real concern, I think, for physicians is that it is the way this virus spreads from people who are either pre-symptomatic. By that I mean they are about to have symptoms, but when they are tested, they test positive, or people who don't have any symptoms or material symptoms at all, but they are still spreading the virus by droplet. So recent concern is about singing and talking in terms of the droplet, whereas before we didn't know that. Now, luckily, the 2-meter rule and the other precautions that we have will still fix that, but it is worrying in that you actually don't know who's infected. And so therefore the social distancing measures which are in are still relevant. And of course, as you know, with Peter's data, we see all sorts of worrying trends in the equatorial side, sub-Saharan Africa, and these other things. So that's the way I look at it. But there's one other point I'd like to make, is that we know that this is now a systemic disease, and there are now good evidence that there are after effects of this virus which was not recognized. And this is coming from some studies in Italy, and we're seeing it in the UK, in that people are having symptoms which range from fatigue, risk of cardiovascular problems, muscle aches, some central nervous system symptoms. By that I mean confusion, memory issues, which is actually something which we didn't know about, and may have some profound effects on people's ability to return to work successfully, which will be a challenge to businesses as we go forward, in those who've already had it, possibility of those who fear they may have it, and that is even before we may have a second wave, which in my opinion is inevitable. As to when that is, I actually don't know, it's your guess. So I think that's how I would summarize where we are at the moment.
It's interesting, isn't it, how it's been a live voyage of discovery. This is your sailing a ship while you're trying to build it issue, and almost every week that goes by, there's some new facet of this thing. So it's, for a business decision maker, it's quite difficult to think ahead, because you don't know quite what you're going to think about. What are the, just a couple of things, what are the timescales we're thinking of, first of all? I guess firstly, on the possibility of a virus actually making, a vaccine making a practical impact on UK population, be they customers or staff. What kind of time scale are we talking about as a possibility? It's not going to be 6 months, is it?
No. This is my opinion. I think the likelihood of getting a workable, practical vaccine before Christmas is highly unlikely. It is possible it could come, some of them, in the first Q, maybe second Q of next year, which is, in my opinion, more realistic. Although there's a lot of enthusiasm that people have said that actually we will get one of them. So we're not going to end up with one vaccine, I suspect. We're going to end up with several, depending on whether you wanted to prevent the disease, whether you try and mitigate some of the symptoms of that disease, very similar with influenza, because with influenza, the vaccine can actually reduce the severity of those symptoms. So there may be that. And then we also have the problem of actually, given that the very susceptible populations, such as the BAM individuals, the age issues, is that the vaccine may have to be different in that group, as indeed it is in the elderly population, is that you have to actually tweak the virus to make it more effective for their immune system to respond. Yeah. But we are a long way away from that, and I know there's lots in the press of being optimistic, and I get that. But it will be the game changer, because because the only way that individuals can cope with this virus is to fight it itself. So there's no effective drug, and there's no vaccine that can help. It is supportive therapy, because the human body actually, Homo sapiens, has not seen this virus before.
So that means if I'm having a board meeting, thinking about what we need to decide on how we can plan for the next few quarters, to all intents and purposes, almost however long my planning horizon is, we've got to assume the virus is here, and it's something we're all trying to live with in one way or another.
That would be my view, because it is. And I think the word that comes to my mind is one has to be flexible in order to manage the business depending on what's coming. Because as you've said, something happens almost in the literature every hour.
Yeah.
I think the figures on research from January for this, because we haven't known this virus for that long, I think the research papers which have been peer reviewed in the journals is somewhere must be now towards 8 to 8,500. So keeping up to date with the press is one challenge. Keeping up to date medically with the medical issues, with the scientific issues, with the pathogenesis, with the vaccine is actually a full-time job.
Right. So then from that, I'm drawing that we're not looking at a temporary issue for business here. We're looking effectively at a permanent issue to deal with.
It's certainly a long game, Peter, in my
Yeah.
view.
Yeah. So in that case, then, could you just maybe give us a sense for where you would be guiding people? I guess there's two groups you've got to think of, three groups. You've got to think about suppliers and what might be happening to them. You've got to think about your customers and how you're interacting with them. And you've got to think about staff and what your duty of care is. Would those be the three groupings to think about?
Yes. What I'd probably do is take it in reverse order, because I tend to do that. Let's look at customers. I think you've got to split the customers to a degree into various sections. So you have the elderly, relatively elderly. By that I mean anybody slightly younger than me or older, whereby they are fearful because they are at risk. So if you look at, for restaurants, for example, is that I haven't met many people who are rushing to go out and have dinner because they fear that because they're at high risk. In contrast, the younger individuals are actually perceive that they're at lower risk, and yes, they are. And so therefore there's going to be a difference in the age group because of the susceptibility to people.
If I could just step in there for a second then.
Yep.
What you're talking about there is the susceptibility to their symptoms. What do we know about, I mean, I'm just thinking about somebody who's running a club for 20-somethings or
Yep.
even younger than that, somebody who's running a school maybe. Those customers, in inverted commas, they may not suffer from symptoms, but are they a part of the spreading?
Yeah, that's a very good point. The answer is, in my opinion, yes, and there's some evidence for that. So we don't know exactly what the role of children are in terms of spread, and of course, as to whether the teachers are susceptible. And that is why there's a lot of anxiety about opening schools and what age you open them and for how long. And then you've got the anxiety by the parents who actually are bringing people to school, where there is social mixing around delivering children, etc. So there is, so in order to be sure and to satisfy all those different groups, let's say in a school, you therefore have to do quite a lot of work about the social distancing, about the general principles of hygiene and sanitization. Social distancing, I think, in schools is really very, very difficult with certain age groups of children.
Well, we have to separate, at least at the moment, we have to separate whether you're susceptible to symptoms from whether you're likely to help infect other people.
Yes.
The fact that you don't get symptoms doesn't mean you might not infect other people.
Correct.
So if I'm dealing with this range of customers, I've got to think about what symptoms they might get, but I also need to be thinking about what infection they might be bringing.
And therefore you have to, I guess, go to something like the lowest denominator. You have to assume that you have to put it for the highest risk. And that can be a problem because some people actually don't. So I speak to lots of people to say, well, you know, I'm pretty safe with this stuff and I can go to the pub and have a drink and this. And if you walk around, you'll see some people wearing face masks and things, which is a totally other conversation I appreciate. But I think you have that virus is still out there, and we don't know really who might be transmitting, and we know how they're doing it, but we don't know who that is. So therefore, you have to take a broader view to say you have to assume everybody does, which is actually the challenge not only to schools but public transport, public sector, and those sort of other sectors.
And then I guess all this applies to staff as well.
Yes.
And I guess the interaction between customers and staff you've got to think about. I mean, as a duty of care for a decision maker, they seem to be all-encompassing problems, are they?
Yes. My personal experience of how businesses have tackled the duty of care so far, I've been fairly impressed by it because they're doing what they can by looking at the basic principles of personal protection, social distancing, and hygiene. The advice actually from industry groups has been, I've been quite impressed by it, to be honest with you. And there seemed to be compliance, and I think the staff are also compliant with actually doing it. That's my personal experience. And so, and I think businesses have to realize that this may be a long game, as you've just suggested.
So I've got a contact I was speaking to a couple of weeks ago, and he's chairman of a company that runs a furniture factory.
Yes.
And he's got lines of machinery there, and these machines take 2 people to run them.
Yep.
And those 2 people can't get 2 meters apart. So how on earth does the decision maker deal with that?
Well, if you can't, and I have had experience actually in the food industry where on some of the lines you can't guarantee social distancing. By that I mean the 2 meter mantra rule. What they therefore have to do is rely on personal protective equipment and what social distance you can, and also the hygiene issues. So they will ramp up the amount of personal protection given that they cannot maintain the 2 meter rule. So they would have to go to a higher level of personal protection in terms of masks and also the visors and also protective clothing. So that's the way they are dealing with it. In that there are for example, if you think of the healthcare sector, when you're treating patients, you can't keep the 2 meter rule. You have to have a very much higher level of personal protection,
right?
In order to accommodate the risk of not being able to do that.
We talk about the issues of people getting infected. What can somebody who's running a business do? I mean, I guess from what you're saying that measuring somebody's temperature is a bit of a waste of time, because by the time they got a temperature, it's too late. Is there anything you can do? You know, what happens when an employer finds a member of staff or a customer in their premises is actually exhibiting symptoms? What do they do then?
Well, actually, they have to actually tell them to go home, really.
What about the other people around them?
Well, that's the problem, because there are some businesses now which, as you've said, are actually doing the temperature checking with all the issues that involves in. And if you think about some of the weather we've had recently, some people coming in actually from a hot car into the location where they get tested, they would be triggering the key temperatures that were there, and they would be told not to come in. What you're then saying is that if they do come in and they've happened to speak to the receptionist, where he or she would be worried about, well, because they have a high temperature or they are exhibiting symptoms, what do you do about those? some businesses are putting in place methods of actually doing testing in terms of PCR testing. Those are the nasal swabs.
Yeah.
And they're also putting in place actually having facilities to do antibody testing of the people who may be worried. So for example, individuals who are going away on holiday and then coming back to the workplace, there are some policies now which are saying you have to be tested first. And if you are positive, then you have to self-isolate for 7 days a minimum. And if that is the case, then the businesses actually, some of those businesses will actually pay for the time that you are self-isolating, even though you've been on holiday.
Okay, so one of the things that intrigues me is that, so far as I understand it, this virus is not something you have once and get over, or it may be, or I mean, you tell me. Is or it isn't? Is it a one and done?
We don't know, is the answer to that, Peter and Simon. We now are recognizing, and there was a recent article from Italy, that they are now seeing individuals who initially became well again, even with mild symptoms, and suddenly some of the people with more severe symptoms who are now exhibiting a whole range of symptoms which are lasting 3 to 4 months. And that affects their ability to be able to perform at work. How one untangles that is going to be very challenging for managers and businesses, because you will get individuals who may not be able to work or just really don't want to because they just feel so unwell. And so therefore, those are the things which we will be facing, certainly in my speciality in the future, in how do you assess that and how do you distinguish that from other conditions which can happen? Because we're going to be entering into the flu season in a few months' time. And so that's going to all get mixed up. But these residual symptoms, and some of these residual symptoms are actually very significant. So there is this aftermath of the virus, which we are just beginning to learn. And the Italians have warned us that they are seeing this in a significant number of people. And so, in other words, this is just not a one-off. In some people, they have no symptoms at all. But for those who do, then there is actually seems that there is an aftermath of this, which we have seen in other conditions. Post-viral fatigue is an example, but there are other things that we haven't seen, and these are some of the cognitive effects of not actually being clear, some decision making, memory issues, which is something that we are just getting to know about because we have only known this virus since a few months.
Fascinating. Well, listen, Tony, that's great. Can I ask you just to give us 3 or 4 things that you're watching for?
I think, just picking up on the last point, I am looking for the range and degree of the aftermath of people who've had COVID-19, proven COVID-19, not the people who think they've had it. This is actually people who've had the disease with positive PCR testing. By that I mean the active virus and antibody positive usually. So I'm looking as to how long those symptoms last for. At the moment, people are still complaining of it 3 and sometimes 4 months afterwards, and how you manage that actually going back to the workplace. The second thing I'm looking out for is the range of symptoms of presentation for this condition, which we now recognize are over and above the normal chronic cough and temperature, loss of smell and taste. And so skin conditions, neurological conditions, which really was not described right at the beginning, but became very obvious during the Italian side. So that would be the second one. Third one, I'll be looking at the research which is ongoing all over the world, and certainly some good studies which are being carried out in the types of medication that may change the way that this disease affects people. You've heard of dexamethasone, which is one drug which has seemed to have a very profound effect, benefit in terms of treatment, and others which not so. And then also looking at the vaccine, because there are several studies with multiple vaccines being trialed, is to see what progress goes on with those. So there would be my first four. I would be interested as a clinical individual. And then there is looking at actually what happens when the second wave comes, is to how one manages that in terms of, by that I mean we've had lockdown. Now we are seeing some evidence of local lockdowns, and will that be the trend? And then the other one, which I think is the sixth or the fifth, is that what's happening globally, because there's certainly things which are accelerating in the equatorial, as you know, Peter, in terms of your data, and the sub-Saharan and South America, and what impact that's going to have globally, because there is no doubt in my mind that those issues are going to be huge.
Fascinating. Simon, you got any questions that, apart from the 1,000 that you must have got?
Yeah, absolutely. I mean, I think we've spent, 15, 20 minutes talking about some of the stark realities that COVID-19, presents us all, and especially business decision makers. And, we often hear it said how important certainty and confidence is to businesses. In such an uncertain world, do either of you think there are anything practically business decision makers can do to actually introduce some level of certainty, some level of a confidence that they can work with going forward? Or do we just have to realise or accept that we can't have certainty and confidence anymore?
Well, I can't remember who it was who said the only thing we can be certain about is uncertainty. For a business, this just introduces a new layer of uncertainty. But from hearing Tony speak today, it seems as though the reality is that this will be some factor in businesses for the foreseeable future. And to that degree, if you kind of work with that assumption, then you're probably in a reasonable place. I do sense that we're all coming to terms with it, if you like. Well, okay, so this is what the future is like for the moment. Well, we'll just have to get on with it.
One of the things I've been reflecting on is that I think the role of managers is going to be very difficult. And the term flexibility, which I think I mentioned earlier on in this session, I think is going to have to be the norm. For example, those who have been furloughed are now going to approach the fact that they may have to return to work. And there is a variability on people wanting to do that. For example, they may be fearful, not so much about returning to work, where the business may be able to put appropriate self-distancing measures and duty of care. But in my experience, the issue for people is actually if they have to commute on public transport, is getting to work. And there's a real fear there. And then you have the range of actually the risk factors, whether they were shielded beforehand. And what I've been advising managers is that it's important to have a conversation with those individuals who are furloughed is to do a risk assessment and just to see what their preferences are and their concerns, and can they help. So I think talking to people is going to be essential to reassure. For example, if there are child care issues where they have to be managed if they have to come back to work, but you don't have those facilities available, then that is an issue which needs to be addressed. And so those are the sort of things which I think we're going to be seeing over the next few weeks as there is a relaxation of lockdown, is that there are some jobs which you need to come into the office. I think we've discussed before, Peter, is that there was already a trend of actually flexibility of working from home, which this whole process has accelerated. But there are some times that you do need the social interaction. You need the facility of actually having exchange of views, which, although Zoom and social media can actually help you, sometimes it's good actually to have those dynamics of actually personal contact, especially in some key strategic areas in business. And so people, although they've been working from home, still have to come in. And there are some jobs that you just can't do working from home. The obvious ones of the aviation, which is another session on its own. But the healthcare sector, for example. And so I think we're just working through that as how we can do it. And there are tools where you can use in order to do risk assessments for people who are extremely vulnerable, who it would not be wise for duty of care to bring people back, and those are not. And those tools are available and can be helpful. But at the end of the day, the manager has to work through all those issues. So it's going to be difficult and tough.
Simon?
Well, that's great. Thank you, Tony. Thank you, Peter, for that chat about business and coronavirus. I think we've all got some very interesting times ahead of us, but hopefully, some of these practical insights that you both have shared today will be of helpful to those who watch this video and are struggling with these challenges going forward. So once again, Tony and Peter, many thanks for your time, and we'll see you all again in the near future. Thank you and goodbye.
Thank you.